Good morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases. Start out, what a lovely day. I got up early, enjoyed the weather, went and got my hair cut so we could be all presentable for our anniversary show here today. And I want to give a shout out to Billy at the Mount Tabor Barbershop. And he has been one of my sentinel predictors of where COVID's gone. So Billy this morning says that things are looking good. We're going to be much better. He thinks the worst is over. And Billy, I agree with you. I think the worst is over. But we'll talk a little bit about what the future might hold. So where are we at today? Well, it's anniversary day, 3rd of March, 2 years ago, was the first case here in North Carolina, which was a person who had been visiting relatives at a nursing home in Washington State where there was a large COVID outbreak, and then returned here to the Triangle area in North Carolina having COVID. First case 2 years ago. We've come a long ways. We've been doing our updates here for roughly the same amount of time, so it's a bit of an anniversary morning. How are our cases doing here in North Carolina? We're down to a 16 per 100,000 per day here in Forsyth County, Mecklenburg County 14 per 100,000 per day. And really other than Brunswick County, which is Wilmington, which is somewhat higher, and our mountain counties, which are still somewhat higher proportion of unvaccinated in those areas. The rest of the state's looking pretty good. 5.8% positive. So in fall of last year, with case numbers like this and a percent positive like this, we were considering ourselves in a really good spot. But unfortunately, December came around, respiratory viral season, and then Omicron, and so had to wear the mask longer and had to get through the Omicron surge. I would say the Omicron surge would be declared. You can declare it pretty much over in our area. It's really no longer a surge. Yes, there's still cases, but as we'll talk about at the end here, I don't think we're in a pandemic emergency anymore, really anywhere here in North Carolina. Maybe still in a pandemic, but moving out of that is time in our next couple weeks as well. So what's happened in the last 2 weeks is the CDC has changed how they rate whether your county is high, medium, or low, which the CDC has been declaring whether you're a high-risk county, medium county, or low-risk county now for almost 2 years, maybe a year and a half. A lot of people didn't really pay attention to it because the numbers were so difficult to wrap your head around and figure out what it meant. To tell you the truth right now, even though there is more news mention of the CDC's new measurements, they're actually even harder to wrap yourself's head around. So here is how the CDC determines whether your county is high risk of transmission, medium, or low. First thing is they look at your number of cases and per 100,000 per day. So for instance, here in Forsyth County and Mecklenburg County, we're in the sweet spot for that. We're well under the numbers that they would consider problematic. So it would put us in the low end of the moderate. And then they look at your hospitals and how your hospitals are dealing with COVID. And one metric there is the percent positive of the people admitted to your hospital which have COVID, a positive test for COVID. Doesn't mean they're admitted for COVID, just means they have a positive test. And as you know, we have asymptomatic positives. And so that number is 15% or lower to be out of the high range. So we're well in that here in Forsyth County at both of our hospitals here. And then the last criteria is the number of people admitted to your hospital in the last 7 days who've had COVID Again, doesn't mean they were admitted for COVID. It could mean that they just had a positive test when they came in, even though they were coming in for something else. So that number is you need to be less than 20. Well, if you're a large referral hospital that takes patients from 21 counties, then that number is hard to meet. And so if you look at the CDC map of North Carolina, the hospitals that are along the I-40 corridor and the I-95 corridor, which are our referral hospitals, by the way, are higher than the rest. So if you go to counties who have small 50-bed hospitals who don't even have an ICU, they're going to be much lower on that map. So you kind of have to look at the information and the data yourself. The other thing is the CDC doesn't update that but every 7 days. So when you're coming down the hill, like coming down the Omicron surge, the numbers that you had a week and a half ago are still being counted against you because it's the number of admissions in your hospitals in the days, 7 days before it was measured. So we were last looked at last Friday, so it would have been the time before that. So they're already out of date when you see it when you're coming down the hill. These new metric is more designed to be sensitive for going up the hill. So when you start to have more cases and you're starting to get hit with the wave, then it measures what's going on in the hospitals. And why are we looking at the hospitals so intently is because it measures the impact of those cases. Because so many cases now, particularly in vaccinated or previously infected people, are mild colds and don't have much impact on the community. Whereas people that are sick enough to go in the hospital is a measurement of total impact. So going by just high, medium, and low by the CDC criteria doesn't really give you enough of a story to know what your risks really are. And so I did the numbers for here in Forsyth County, and I did it for Guilford and Mecklenburg. Mecklenburg, by the way, I think technically is officially moderate right now, yellow on the CDC. But I did the numbers, so we would be in moderate had we been taking the numbers as they were over the last week here in our area. So that's where we're sitting, which is one of the reasons why, when I did the projections, that my recommendations were for the city of Winston-Salem and for the school systems that this week that they could go to mask optional states in those areas. And I still stand behind that advice, and I believe it's sound advice. I think our transmission's in a much better place. Now, having said that, there are still cases occurring, and the more severe cases are still in the unvaccinated people, and a small number of people with underlying health problems, particularly those who are immunocompromised. And so we still have to do things a little bit different for those people, and we'll talk a little bit about continuing to use one of our tools that has gotten us a long ways through the pandemic, and that's our masks for people who need it. So our cases actually across the world are actually coming down now, about a 16% drop across the world. Interestingly, there's a few countries that are having more problems now. I'll point out South Korea and I'll point out New Zealand. So New Zealand got through the whole pandemic with basically no COVID. I mean, it's an island, and they were very careful about how they let visitors from other places into their country. And if there was one case in a town, they would do a whole lockdown in that one town. So it was pretty strict, pretty stringent, but it worked, and they kept their numbers down. Now they've decided that it's time to start relaxing some of their restrictions, and they're doing so. But they have more of a non-immune population, so their cases are going up. But they are more vaccinated. But, you know, with Omicron, breakthrough cases happen with Omicron, and they're not uncommon. And if those people go get tested, it'll get counted as a case, whereas the country impact may not be quite so high. Same thing going on right now in Denmark and the UK These are, highly vaccinated areas where you look at their case numbers and it's like, they're having a problem. But the impact on their society really isn't so huge. In fact, England, which was really the first one to have the brunt of Omicron, is basically releasing just about all their restrictions on everything here in the next couple 3 weeks. So and they're a little bit ahead of us. Now, while I may be presenting a bit of a rosy picture, and I am, it feels good to me to be able to talk about positive news in COVID for a while. We got to keep our eyes out for those variants that might be on the horizon. Because variants, there's two things that are a problem with the variant. That one is are they more transmissible than the circulating virus? And the second is, do they evade immunity? So if you've had immunity by previous infection or vaccination, will the variant get around it and go around that roadblock? And then lastly, you have to know whether the variant causes more serious disease than the previous variant. So the one variant, as an example, that we've been watching is the BA2. Some people call it the, quote, stealth variant, because it's a little bit harder to identify just looking at testing de novo. You have to do a full sequence on all your COVID isolates. And then, but people have been following that, and there are some countries in Europe, Denmark one of them, where it's the predominant variant now. So that variant's a little bit more transmissible than its father, the Omicron itself, the BA1 variant. But is it that much more transmissible? Maybe for a population of people, it's more transmissible enough for it to get a toehold in and kind of push out its dad. And that's happening. But for an individual, is it that much bigger of a deal? Probably not. The transmission factor or secondary attack rate is not really that much higher to make it a bigger deal for a person, one single person. Because what you do and how you do it is going to have much more of an impact and overshadow it. The other thing is does it evade immunity? And the data is pretty good now. No, it's not going to. It doesn't evade immunity any more than its father, the BA1 variant, and it doesn't evade natural immunity anymore either. And so if you've been previously infected or vaccinated, and particularly vaccinated and boosted, you're just as protected against that as you are against the BA1 and Omicron. So I'm not really too worried about BA2. It's really not a variant of concern. It's a variant of interest, but not of concern. And right now, looking at the radar, the variant radar, I don't see any others out there right now that are too worrisome. And when the variants come up is when you have increasing numbers of cases, either somewhere else in the world or here in the U.S., rather than decreasing. So I think we're not going to see any variants for a little while. I won't predict never, and it could be possible in the future. And we just have to watch that, and we have to watch our sequencing. I've been asked, are there any BA2 variants here in North Carolina? A handful. We've had a small number, both down in the Charlotte area and up here in the Winston area. And when I mean a handful, I mean a very small number, like less than 5. Wake County and the Triangle, I'm not so sure about, but it's less than 5%, which is the of all of our COVID that we're seeing right now in the state. So schools and universities. So our schools here in Forsyth County, and including the private schools, all decided to go mask optional this week, and we'll talk about what mask optional means. We're still doing contact tracing here in Forsyth County, so we can just kind of keep an eye on things, so we can compare it, whether masks off are a problem, I don't think they will be, but we need to watch it to make sure. So for a little while, we're going to still watch that. In the Wake Forest University is going mask optional when they get to their spring break, and that's next week. Except in the classroom, it'll be mask for one more week after that, and to give people time to make that transition. The city here of Winston-Salem, we went without our masks, or mask optional, on Tuesday. Although looking around in the grocery stores and out in different areas and workplaces, I still see a lot of masks being worn, and that's okay. And I'll talk about, about the masks here specifically in a minute. Just a shout out for Wake Forest University. I think there's been the number of students who've had COVID in the last 3 weeks is less than 5. And for a large university that has a lot of residence halls, that's just fantastic. So hats off to the leadership, the students, the faculty down at Wake Forest. The Omicron surge was a little bit of an annoyance at that university. It wasn't a major problem. So I think it's a great hold it up to the rest of the country to show how it can be done. Now let's talk about the mask mandates and masks coming off. Here at Wake Forest, or Atrium Health, up here in the Wake Forest area, we are going mask optional tomorrow for our academic spaces, for administrative spaces, and for our education spaces. The hospital and the acute care hospital and the clinics, masks will still be required. And so for those of you who are Atrium Health, Wake Forest Baptist employees, teammates, that's the way it's going to be for us. So in the campuses and the buildings where there are no patient care areas, you don't need to wear a mask, for example. In the early education spaces and some of the other buildings, you don't need to wear a mask. And the communication has gone out, so you can look for that on the intranet or in your email, and you'll see it on how to do that. But the important thing is for everybody in the entire community, and in the entire triad, is that when you're going into a healthcare facility, be it a hospital or be it a clinic, you need to wear a mask. And that's because we're under OSHA rules. And to tell you the truth, it's a good idea because there are more people who have illnesses going to hospitals and clinics. And when you get sick, what do? You go to the doctor. And so we need to have that protection for our staff and for our other patients. So be a good citizen and wear your mask for health care because it's important. It'll also help protect you. Now, masks, as time have come on, have been an important tool for us. And I'm not going to diminish that. You'll see a lot of stuff out on social media, a lot of misinformation saying masks don't work. They actually make you sicker. That is not true. I will emphatically say that is not true. I, as a doctor, put on a mask when I go into a patient's room who has a highly transmissible infection. And masks work. It protects me. And why otherwise would surgeons not wear masks? I mean, surgeons have been wearing masks since the early 1900s. It's done for a reason, because it protects them and it protects the patient. And masks work. Masks work in communities. We have a lot of data now that communities who wear masks have a lot better mitigation for the spread of COVID than communities that don't. We know it in schools. And so if you say a mask doesn't work, you're just plain wrong. They do. It's an important tool. So the question is do we still need the mask? Do they work, but do we still need it? Is it a tool that we need to pull out or keep in the toolbox? So if you're used to fixing things around the house, you pull the tool out of the toolbox when you need it, and you use it when you need it, and when you don't need it anymore, you put it back in the toolbox, and maybe you get a different tool out. So times are different now, and such a large proportion of our population's been vaccinated. A whole heck of a lot of people got COVID during the Omicron, and that gives you some immunity. We have treatments now that are in good supply for people who are at higher risk. And we have a good supply of N95 masks that you can use to protect yourself. So we're moving, it's a stepping stone, moving from a pandemic to an endemic virus. We are going to put the mask back in the toolkit for the society at large, but if you're a person who still needs or wants that tool, use it. So who really needs to continue to use that tool? People who have underlying health conditions that put them at higher risk for COVID, people who are immunocompromised, and people who are at the extremes of age. They probably still need the tool. And let me give some examples. So if you have some heart disease, some lung disease, if you're a dialysis patient, if you are on cancer chemotherapy, if you've had a bone marrow transplant or an organ transplant, if you're pregnant, which puts you at higher risk for COVID, if you have a BMI over 30, so if you're overweight, these are people who have higher risks. And you might want to wear a mask when indoors, particularly if you can't social distance and it's crowded. So you can make those decisions on your own, and you can use either a surgical mask or an N95 to protect yourself. The N95 is the best for protecting yourself, and I can tell you, because I do this as a doctor, you can walk into a room with other people with COVID. If you're wearing your N95 and you got it on right, you're going to be fine, even with the underlying health problems. So there's some people who might want to continue to wear masks. There are also some people who are still a little anxious about it. I mean, we've been wearing masks for 2 years. It feels funny to take it off. You kind of feel a little bit out there, maybe like you're not quite, protected. And so if you want to wear your mask for a while until you feel more comfortable and safe about it, that's fine too. If it makes you feel better, use it. That makes sense to me. There's another group I forgot to mention 2 weeks ago, but that might want to think about it. If you got a big event coming up and you'd rather not have COVID for that event, just like you'd rather not have the flu or you'd rather not have some other viral crud, wear your mask a while before the event. Let's say your daughter or son's getting married and you're having a big get-together. You may want to lay low for a week or two and not get sick. I mean, it just makes sense. Wearing a mask will help you with that. If you're going on a big vacation and you've been planning on this vacation for 2.5, 3 years, and if you all of a sudden got sick and couldn't get on an airplane or you couldn't get through customs or immigration, I'd probably wear a mask for the week before that, because I don't wreck the chance to have my cool vacation. So you can use masks for that too. So the bottom line is that it's time for society to not really need to make all these decisions for us all the time. We can start to shift and make them on their own. And that's a very important stepping stone. It's an important stepping stone of going from an epidemic or pandemic to being endemic, because COVID's not going to go away. It'll be around. So next respiratory season in January, when it's normal cold and flu season, COVID will be part of that too. Maybe we'll put a mask on for a while again, but we don't need the government to tell us to do that, because we can protect ourselves by doing it. One of the other groups that might want to continue to wear masks for a little while, and I would recommend it at least for a couple more weeks, are daycare centers, for 2 reasons. One is kids in daycare can't get immunized yet. The other is that respiratory viruses are just more of a problem in daycare centers. They have been since the beginning of time. And so until our case numbers come down a little bit further, And I would probably want to wear a mask or have my child wear a mask in a daycare center. And I'd certainly have the staff continue to wear masks. Daycare centers are going to be spending a lot more time outside. The weather's nice, kids love to be outside, and it's a great place for them to be, which will make them safer anyway. But let's see how things go in the next 2 weeks, and then I'll tell you in 2 weeks whether daycare centers can start to relax that too. We still also need to wear masks on public transportation, although on school buses you don't need to. That was a special exemption. But other public transportation, even like a type of a community shuttle bus, so if your living community has a bus, small bus, or your university or your school, if it's not technically a school bus, you still need to wear a mask. Masking on public transportation, including airplanes, is going to get evaluated here again in another week or two, because the federal mandate for that's going to expire, so we'll see what they have to say. I can tell you the airline employees would like to have them stay, because airplanes are a place of a bit higher transmission risk, and the mask helps there. But we'll see how that goes. Let's talk a little bit about vaccine. There's some new things out in the news. Novavax, which is a vaccine that's available in some countries in the world right now, but not quite yet there in the United States, is a vaccine that's made a little differently. You know that Moderna and Pfizer are messenger RNA vaccines, and J&J is a vaccine that uses a replication incompetent adenovirus, which is a fancy way to say an adenovirus that can't do its job to get the messenger RNA into you. And then once the messenger RNA is in us, then it makes the spike protein, which we get immune to. And these are the vaccines that we've been relying on. Novavax does it a little bit of a different way. It actually takes the spike protein itself and then adds it to something called an adjuvant. And an adjuvant is an immune system tickler that makes the body respond better to that protein. And this is the way we've been making some of our vaccines here in the United States for some time, including hepatitis B, the HPV vaccine, the new shingles vaccine. These are all protein adjuvanted protein vaccines. And so we're used to that. And there's no messenger RNA component. There's no genome type component in it. So some people might be more comfortable with that, and that's fine. And so when that vaccine comes out, it looks like its efficacy is probably about the same as the messenger RNA vaccines. We don't have as much data with the Omicron variant, though, because it hasn't had enough experience with it yet. But that is at the FDA right now. I suspect it will be approved. When is that approval going to happen? In the next few weeks, I think. It's getting closer. So that's one to keep your eye out for. There's another vaccine that is made by Sanofi, which is a big vaccine company. They've been making vaccines for ages and decades. And that they have another protein adjuvanted vaccine. That one is not quite got enough data together yet to go to the FDA. So it'll be a while, but I think it'll be out on the horizon. Early data shows that it's probably not quite as good as a messenger RNA vaccine, but it's pretty good. So keep your eye on that one too. That one's further off, but look for Novavax in the near future. Some other things, some more data that we've gotten with vaccines and COVID transmission. So where COVID transmission is its highest is in a household. Obviously, you're living together, you're sleeping together, you're eating together, playing together, going in and out of the car together. So you got a lot of time together where a virus can get transmitted. So the rate of transmission in a household for Omicron, if you've not been vaccinated, is roughly, the attack rate, what we call it, is roughly 70%. So 70% in that household will get it if there's another person in the household. Maybe your own experience has been that way, talk to your friends, but Basically, as a household of 4, usually 1 out of 4 escape, and that's about it. Now, if you've been, that's if you're unvaccinated. If you've been infected before, at any time during the pandemic, and you know you got COVID, and you were test positive for COVID, and you had symptoms, then the transmission rate's about 50% or a little bit less. So it helps protect you. And then if you've had vaccine, the attack rate is a little bit higher than that, maybe 55% attack rate. So the bottom line is if you're in a household and you have tons of exposure, and that exposure is to the highly transmissible Omicron, your chances are pretty good you're going to get it, whether you're vaccinated or not, because there's just enough virus and time of being exposed to that it gets into the nose and it starts the infection. But if you've had previous infection and or you have been vaccinated, particularly if you've been boosted, then you're going to get a breakthrough infection rather than getting a serious infection. And a breakthrough infection is largely a cold or a mild case of the flu, and that we can live with. So it's pretty good data about how the vaccines help us in the most high-risk area, which is a household transmission. We also know it in healthcare, by the way, where we get exposed to COVID quite regularly. But most of the time we're wearing a mask. So we have a different and another tool with us. So that brings me to the point of how immune is our population right now? Well, our population is immune enough so that the Omicron surge left us, and we're over it. The surge, anyway. The virus will be around, but the surge is over. And a study just came out that the CDC sponsored and paid for, looking at antibody levels across a wide swath of the population, including here at Wake Forest Baptist. We were part of that. And so it turns out that amongst kids that of all ages, greater than 2, I think it was, about 60% of our kids have gotten COVID sometime during the last 2 years. That's a pretty high number. A lot of them were asymptomatic or had such mild infections that just went under the radar screen. 60%. And then in adults, it's a little bit less than that. Just a tad over half of us have gotten COVID over the last 2 years. Now that data they stopped collecting at the end of January. And if you remember, the Omicron surge wasn't even over then. There were still a lot of people getting COVID after that. So the numbers are actually probably even higher than that. So we're at an area now where, at least to the variants that we have right now, our immunity is pretty darn good. And that's why we're talking about masks coming off, and that's why we're talking about relaxing some of the other few remaining restrictions we have. So that's good news. Now, if you're immunocompromised or have a lot of underlying health conditions, then your antibody levels fall quicker after immunization or after natural infection, and that's why the mask still makes sense for you. So where are we going to be at over the next few weeks in the summer? Well, I can tell you that I think it's a good time to start planning your summer vacation. In fact, if you haven't done it yet, good luck finding a place if you're looking for rental property or a hotel, because a lot of other people have already been booking up. I think it's going to be a good summer. And I know that camps for kids are also booking up quick, day camps or so. Overnight camps, I think that if you're a child and you want to have an overnight camp for your child, go for it. There may very well be a vaccine requirement though. Because most camps that are overnight, I think, are going to require that COVID vaccine. If not, they should. I think if you want to go to Europe or travel, things are starting to open up considerably. A lot of countries are dropping their quarantine requirements, their testing requirements, and and even Asia, Southeast Asia, Thailand, and Vietnam are going to be relaxing. Right now they're kind of hard to get into, but they'll be relaxing their entry requirements here too in a month. Even Hawaii is relaxing their entry requirements. If you're doing travel like this, take a look at where you're going, look at exactly what the requirements are, just to make sure. But particularly if you're vaccinated, most places you won't even need to test. Except for right now, coming back to the United States. If you're returning to the United States, internationally, you have to have a test within 24 hours. And you can use home tests, but it has to be done in a video monitored type of way. And so make sure you look at the fine print on the INS and the CDC travel website on how to do that. Will that requirement go away? At some point it probably will. I don't know when, because it won't make sense. The other thing that I think we'll start to see go away are contact tracing, quarantine, and isolation. Now, one of those is actually coming true now. The CDC no longer recommends contact tracing, and except for certain high-risk populations, jails, prisons, nursing homes, cluster outbreaks in congregate areas. If you had a school that was having a large problem, you would do it. So it's more in response to a problem than it is just widespread contact tracing, which means that if you've been exposed to COVID, you're not going to get a phone call from the health department anymore. Does that mean you shouldn't lay low after being exposed to COVID? No, you'll probably still want to do so. If you're vaccinated, that means just getting tested 3 to 5 days after that exposure. If you're unvaccinated, you should stay home for 5 days and then get tested. And then you should wear a mask for 10 days after that exposure. But it means that the government's not doing it for you anymore. I think at some point quarantine will go away too, because we don't quarantine any of our other respiratory viruses, including influenza. But right now it hasn't, but I think it will. And when you think about it, it makes sense. If we're transferring responsibility for virus transmission and protection to the individual, and quarantine is kind of, we may not need that tool. But that doesn't mean you shouldn't be a good citizen and you shouldn't do things that make sense anyway. If you get exposed to COVID and you know you are, be a good citizen. Lay low for 5 days if you're unvaccinated and get tested 3 to 5 days after that exposure. Wear your mask. Hey, I could have it. I could be an asymptomatic carrier. So wear a mask for the 10 days after that exposure. It just makes sense. Just do it. If you get sick, stay home. I mean, that's something we should have been doing for decades, right? Don't go to school or work with this big snotty runny nose or cough. Be good, be kind to your coworkers, be kind to your other students, and don't go to work sick. And if you're recovering and you say, hey, I'm mostly better, tomorrow I think it'll be completely gone, then wear a mask for 2 or 3 days. Don't give it to other people. So we're just going to have, this is what the virus being endemic is going to mean to us. These are decisions we should be making going forward. And I think it'll be fine and it'll be good. I don't think we need the government to tell us anymore what to do, unless COVID changes or a new variant comes or something really shifts the nature of the pandemic or the epidemic. With that, I got forwarded a question. I got one J&J shot, then in November a Moderna booster. I have not had COVID. Should I get a third shot, like a second Moderna booster? I would say yes. That would be my recommendation. And let me tell you about Dr. Ohl's 3 immunologic hit theory. And it's more than just a theory. There's pretty good data behind it. That you really need, your immune system really kind of needs 3 exposures to COVID to get a pretty good level of immunity that I think will be long-lasting. And what does that mean? 2 shots or getting the infection. That's 3, right? Shot, infection. You've had 3. Or if you've never had COVID, 3 shots. 2 shots and a booster. If you've had COVID twice, you've got 2. You only need a booster. So go for 3. 3 is the answer. You won't find that written down anywhere, but I'm kind of looking at the data and trying to determine what it'll mean. I think you're going to see more information coming out of the CDC's ACIP committee on basically how to make sure you stay vaccinated. Will there be a 4th shot? Will there be a booster to our already boosted state? Probably not, except maybe in the fall before we get into respiratory viral season. We'll have to wait and see how long, what the data shows as far as breakthrough infections and escapes and what variants we might have then. But I don't see any in the near future. One other thing I want to say about vaccines, I didn't mention it earlier, but now. So for kids, the under 5 kids have not yet had an opportunity to get vaccinated. And the FDA looked at the data about 2 shots in the under 5 group with the reduced dosage vaccine for that group. And it turns out that the antibody response and protection isn't good enough for 2 shots. So we're looking at a 3rd shot for the under 5 group. That study's ongoing, and we'll probably have enough data accumulated that the FDA will be able to act on that in mid to late April. There are no problems with safety yet whatsoever in the under 5 group. It's just making sure it works as best it can. And it looks like 3 shots are going to need it. In the 5 to 12-year-old group, it looks like using the 1/3 messenger RNA, which was Pfizer, that was the one that was approved for that group, or the 1/3 of the adult dosage, fades faster in the 5 to 12-year-olds than it does in adults. And that means there'll be a 3rd shot, I think, coming for the 5 to 12-year-olds. When will that 3rd shot be coming? I would predict sometime roughly about 4 to 5 months after the end of the 2nd shot. And since the 5 to 12-year-olds couldn't get shots until the end of November, and the 2nd shot would have been in December if you got it right away, and then you wait your 2 weeks after that, that was roughly Christmas time. So we're talking about April or May. And so look for a recommendation for boosters for kids, 5 to 12, so that 3rd shot for them at that time frame. Should parents be worried that their child's not fully protected? No, I wouldn't be worried actually, because it turns out that the waning immunity is more for a breakthrough. But those kids look really well protected still for hospitalization and serious consequences of COVID. So I wouldn't worry, wouldn't panic, but just look for the booster recommendation for the 5 to 12-year-olds coming out later this spring. So that, we have a question. I'm looking at my colleague from Spectrum News.
Today marks the 2-year anniversary of the first reported case. What are the lessons learned from that?
Well, that's a big question. What are the lessons learned as our anniversary from the first case? Well, let me throw it in broad terms rather than give you the textbook. First, that I think we learned about how highly transmissible respiratory viruses transmit through populations fairly quickly, and how the hopes of eradicating that from continuing, in other words, stopping it and making the virus become extinct, is extremely difficult and probably impossible for highly contagious respiratory viruses. And there's a lot of reasons for that, but I think we've kind of learned some about that. I think we also learned that lockdowns work, but they're extreme and they're painful. So to lock down a community, you remember, almost 2 years ago, weren't many cars out on the street. But it really did flatten the curve, which is what we wanted to do then. Otherwise, our hospitals would have just been overrun. And it got us through the first wave, the lockdown did. I think we learned that masks are a good tool, and you use them when you need them. And they really helped us get through some of these waves without having to do a lockdown. We didn't have to lock down during Delta. In fact, most of the schools, public schools, were open again. But masks are what got through us through Delta. I think we also learned that political divisiveness and politics getting into public health is not a good idea. It slowed down our responses, and there were excess cases and there were excess deaths because of that. And that just didn't need to happen. And when we have our pandemic again in the future, some year, could be decades away, but someday one will happen again. We don't need that part. We need to get and respond together. And I think we learned that you respond to data as new data comes in. And if you have new data that says you should be doing something different, you be nimble and you change and you do something different, whether that means adding restrictions or taking away restrictions. Respond to the data and respond to that. And then I think we also learned that communication is huge. And I feel really good to be a part of that for the Triad community up here. And I really thank all you guys for the media for being, an extremely responsible local, state, and regional reporting and helping us get the word out. So thank you.
What would you say the biggest accomplishments or missteps taken by the state, nation, and world during this?
Oh, missteps? Oh boy.
I said compliments too.
Yeah, compliments and missteps. So compliments, I think, public health in all of those areas, both locally and at the state level and at the national level, have really been kind of strangled over the last few decades because we've been complacent. You don't throw as much resources into it when things are going well. But I think we found out that the marginalized populations it wasn't so true for them. Those who are social and economically and racially disadvantaged. The public health responses in those areas. So the public health has done a bang-up job. I look at my colleagues at the Forsyth County Health Department, and man, a shout out for them too, because for a year and a half, these guys work 7 days a week. They worked hard and provided good information and data. And that was true both at the local and at the national and state level too. A lot of people have just hung in there and worked hard for a long time. And we need more resources in public health. I think we've learned that. And we can't say, oh, pandemic's over, time to starve public health again. We can't do that. But I think the biggest lesson learned is that those problems that exist in a society and in health systems prior to a pandemic get magnified and amplified during the pandemic and become even more of a problem. So the problems with access to health care that we have in the United States, either in the uninsured or in persons who are marginalized, it really got amplified. And there were higher hospitalizations in those groups, and there were higher deaths. And there are issues with our healthcare system that really need to be relooked at and fixed as time goes on, and there'll be some complicated decisions to do that, and some difficult decisions moving forward. But I think we need to take the lessons that we learned from the last 2 years and apply them and shore up our public health, shore up how healthcare is delivered, and remove disparities in care for our more marginalized people. And that'll help us not only for the next pandemic, but for delivering health care, prenatal care, the basic tenets of what we need for health in the interim.
Kind of piggybacking off that, I don't think it's hyperbolic to say that it's hard to find someone who hasn't been changed in some way by the last 2 years. I think we've all changed a lot over the last few years. How do you think you've changed since we first started having these updates to where we are on this 2-year anniversary?
Oh boy, that's a good question. By the way, my colleagues from WXII who've been with us throughout the entire pandemic, so thank you for that. So how have we all changed? Well, COVID's touched all of us one way or another. It's either just touched us as a minor annoyance back during the lockdown, or changed the way we work and play, or it's really impacted. And I'm talking about people who have had loved ones who have gotten seriously ill or died. I mean, we've had 800 deaths here in Forsyth County. That's not pittance. And for those people, it's tragedy, and it's sadness. And so I won't say that, how has it affected me, because for the people who've had loved ones who have gotten seriously ill or died, nothing can be worse than that. So how has it changed for me? I reevaluate a little bit about what's important and what makes a difference. And I think that, we can find ways to work, be it Zoom or whatever, using other ways. But, for those things that are really important and meaningful, we need to make sure we take care of those things. And I've also learned about the power of communication and how it can make a difference, because I really think here in the Triad we've done a really good job with it, and I think it's helped. I think it's made a difference for our community, people have reached out to me to thank me for helping do that, and it makes me feel good. It's probably the most rewarding thing I've ever done in my entire career. So, so there are, those kind of high spots. Probably would rather not have had a pandemic, but, there are, the message I have for my students and my medical students, because the medical students had to go through, all of this, and it really hit their education, because for a while they couldn't see patients and then they had to do things. And I said, well, I learned a lot from the hardship times during my training and early in my career. And I learned a lot. I gathered a lot of skills, and I put those skills in my toolbox. And when time came, I was able to pull them back out again. And those include skills, in leadership and communication skills and working with people. And so, I'm not going to use that tired phrase that, it just makes you stronger, but you take what you've learned. Everyone should over the last 2 years and use those things that we've figured out. So, but thank you for that question.
I also have one more. While you've said there's a lot of good news on the COVID front at this point, long COVID is certainly a real thing. And for folks who are frustrated, perhaps they had COVID and are still struggling to bounce back, what kind of encouragement can you give to some of the folks who maybe have already gotten through the worst of it, but are still dealing with these lingering effects?
Long COVID. I don't want to diminish that for those people. So long COVID is still not well understood. We're starting to figure some things out about it, And the reason we don't understand it quite so well or so fast, because it really gets at some of those not yet well understood mysteries about the human body that we're still figuring out. Because long COVID probably has to do with an inflammatory response in certain areas that doesn't get shut off when it's supposed to. There are a lot of other entities in medicine that come from that same problem. But some of the things we've learned about long COVID, one, with time it does get better. But it does take time. The second thing that we've learned, and some data out of England not too long ago, that if you get vaccinated and or boosted if you've been vaccinated, it seems to help. Somehow it makes it's like hitting the reset button for your immune system a little bit. So it does seem to help. The other thing is we're learning about exercise tolerance and how to go back to exercise. And so rehabilitation and rehabilitation aspects of medicine are learning more about that. There's going to be a lot of research about long COVID. Because of that research, we're going to learn more about our immune systems, and there'll be positive things that come out of that. We're also going to learn about some of those long-term effects that happen after other viral infections. So long COVID wasn't the first. I mean, I've been seeing people throughout my entire career in medicine who get some type of acute viral infection and then have these prolonged symptoms of fatigue and tiredness and headaches and mental fog. And so there are a lot of other viruses that can do it too. COVID seems to be more adept at it though. But I mean, it's also Lyme disease. For some, who get Lyme disease, it takes them a while to recover. And so we'll learn more. And this is a great time to apply the research and the money and into that and learn more to help everybody who has these things. Any other questions?
We had a question about vaccines, asking if you thought there was a timeline of Moderna getting full FDA approval, as well as if you foresee there being like an annual COVID shot.
Yeah, so full FDA approval for Moderna. So full FDA approval for Moderna is for adults is done. It's out. So for kids, it'll be a little bit further down the pike because the application went in later than Pfizer's, and the dose ranging is a little different. So that'll be a little bit further out. And then boosters will be a little bit further out because boosters came after the initial vaccine series, and the way the FDA gives approvals, it has to be looked at separately. I kind of consider Moderna approved as a booster already, but what was the second part to the question?
Annual COVID. Do we think it's going to become like the flu shot?
Yeah, will there be an annual COVID shot? It depends on a few things. Whether or not we need an annual COVID shot prior to respiratory viral season depends on these things. One, how long lasting and how robust is immunity from Omicron? If it's long lasting and robust, then it probably won't be annual. It may be more periodic, kind of like a tetanus shot. The second thing it's going to depend on is variants and how far variants go around to escape immunity in the future. Omicron didn't vary enough, it turns out, because the vaccine still worked pretty well against it. There were breakthroughs, but the breakthroughs weren't of high impact. So it's going to depend on those two things. And we'll see. But as time goes on, we'll have more vaccines available for that if we need it. All right, so I'll go ahead and I will see you in 2 weeks. I think we'll still have some updates enough to get together in 2 weeks. And we'll see how things are going now that we've taken our masks off.